What about sperm count? For men who want to father a child, the issue of sperm count is not an abstract or scientific one. It is an issue that affects his dreams of the future and hopes of raising a child that is his own. Many people really do not understand what sperm count is. A man's sperm count can tell you how fertile a man is or how likely he is to be able to produce offspring. Sperm count simply means the number of sperm in a unit volume of semen. While the normal range falls between 20 million and 150 million sperm per milliliter, lower sperm counts can cause fertility problems. If a couple is having trouble conceiving, a physician will probably recommend that the potential father have his sperm count measured. This will let the couple know whether his count is in a normal range. It is important to keep in mind that having a low sperm count does not mean a man cannot father a child. It just makes it a bit more difficult. One thing that men have in their favor is the fact that time is not as much of an issue as it is for women. While women become less fertile as they age, then eventually undergo menopause, men remain fertile well into their later years. Although some studies show that sperm counts decline around 30%, this is definitely not enough to deem these males as infertile. To easily obtain conception, it is not just important that a man have a high sperm count. Sperm motility also factors into the equation. Sperm motility is so important at the time of fertilization because it assists the passage of the sperm. Non-motile or especially motile sperm usually does not lead to fertilized eggs. If you are anxiously trying to conceive a child, there are things you can do before enlisting the aid of a specialist. Did you know that there are certain days in each month when couples are most likely to conceive a child? By having intercourse on those fertile days, you increase your chances of having a baby. Timing the woman's menstrual period is integral in determining when she is most fertile. About 14 days after a woman starts her period, an egg is released. This egg lives for about 1 to 2 days. This does not mean those are the only days you can get pregnant, however. In fact, in ideal conditions, sperm can live for 5 days. Still, having intercourse during this period, referred to as ovulation, will boost your chances of conceiving. Inexpensive ovulation tests can be purchased. They work in the same way as a pregnancy test. The woman can test her urine to see if she is, in fact, ovulating. If so, she will know it is a good time to have intercourse. Although this method is not foolproof, it certainly helps your chances of conceiving, especially if your sperm count is not as high as it could be, or your sperm have motility problems. If conception is eluding you, then it is important to realize that a visit to your doctor is in order. He or she can best advise you on ways to maximize your chances of having a child for your particular situation.